at UCCI and the work that we do there to help to enhance the lives of young individuals who want to be nurses. Um, yeah, I've been in this business for a long time. And I hope we will all talk together and learn together this evening.
Sure, you're going to join in this evening by joining the conversation.
All right, good afternoon, everyone. My name is Natalie Kam. I am a registered nurse by profession, have been a nurse since 2007. I have years of experience in emergency room, medical, surgical. I'm also a nursing preceptor. In the past, currently, my current position is occupational health and safety manager. I do love nursing and I do love to get involved. I'm quite shy, so I'm very glad that the place is small so we can have a nice, intimate conversation about this chronic disease. I always pray, Lord, use me. How can you use me, even though I'm so shy and reserved? So if you see my hand shaking and anything going, just say, just pray for me, okay?
Okay, so now you have it, okay? All nurses up here, and I think we have been involved in diabetes at some time or the other. The department, the health ministry department, got together because every time we have screening, we always find somebody that did not know they are diabetic. Point in time. Last time we did screening, I found somebody whose blood sugar was 525. 525. Yes, you're looking, that's true. I had to turn the machine upside down, downside up to see if I was seeing right. And I asked, are you diabetic? Yes. Have you taken your medication? No. I am trying to do herbal. So he's not doing the herbal because I'm trying, okay? And he's not taking the medication that was medicated to him. So, yeah, so we thought together that, a lot of persons are diabetic and they are not even aware of it. And when they are aware of it, they are not looking after themselves. So I think today, as we talk about stewardship, we will be concentrating on our body temple, okay? This is the body that the Lord has given us, and we need to take care of it. We are partnering with God, with the body that he gave us to take care of. Diabetes has been called non-communicable disease, NCD disease. It is also called lifestyle disease, and it is also called sugar daddy. I'm sure you never heard that before, right? It's also called sugar daddy. And it says sugar daddy has a lot of children, right? So we were first hearing that. So we were concentrating this evening on talking about these children, but we will have too much time, so we'll be talking about diabetes in itself. So the first person I'm going to call on this evening is Natalie, as we sit down, and you can ask any question anytime. Do you mind having interruption while we're talking, or we should wait until?
No problem.
Okay, so go ahead, Natalie, and tell us what you know about diabetes.
All right, so as we said before, diabetes is a chronic illness. And diabetes, you'll always hear it in a terms of people say they have sugar, right? So when you hear diabetes, what comes to mind? And this is a very interactive session that I will have with you. What do you think when you say sugar? People say their blood sugar is high, right? So in breaking it down, diabetes, as it says, it's a chronic. It's something that you can control. It's something that you can reverse despite what pharmaceuticals and doctors may say with proper management, right? So I'll talk to you about some of the symptoms because we may just hear the word loosely, but some of the things that you may exhibit. What are some of the symptoms that you may exhibit? Definitely thirsty, always want some water to drink. Passing urine frequently, so it's more frequent. And what comes with frequent urination for us ladies, or even gentlemen too? Yeast. That's one of the indicators, right? So what else? So we pass in our urine, we are drinking a lot of water, we have the yeast. Tired. You always hear the person, I'm so tired, I'm constantly tired. What else? It happens with your fingers and your toes. Numbness, that feeling, that burning sensation that I'm having in my toes, it's burning, it's not going away, right? So that is it. What else? Your vision, definitely. Oh, I'm not seeing clearly. I think I need glasses. The vision is not that clear. In addition to that, you have a wound that never heals, right? It takes forever for this wound to heal, and we do everything under the sun to deal with it. So these are just some of the common ones that will trigger us. Hungry. Yes, you can never be satisfied no matter what you do, right? What you eat. So you're hungry, you're tired, you are having this frequent urination, you're thirsty constantly. So if you see that you're exhibiting any of these, it is time to check with your GP, your private physician, and see what is happening. So they'll say, okay, let us do a random blood sugar. A random blood sugar, they'll do it right there and then. And as Nurse Fletcher said, you may do it and you see your numbers in the 200, in the 300, in the 400. That should be a red flag for you. Because if your numbers are in that level, it means that your body is not regulating that sugar properly. So in our body, once we consume sugar, and when we talk about sugar, it's not just the sweets, right? Because we take the crackers and all of those carbohydrates, those are also converted to sugar, right? And when our body does not, the pancreas is the organ that is responsible for that produces that insulin. I hope I'm not touching into anybody's topic, right? So once your body starts taking in that sugar, it should break down that sugar, and your number should be 120, whether or not even if you're not diabetic at that time. Your body will just break down that sugar. So you eat, the insulin is produced, breaks down that sugar, and bring the sugar level to a normal level. But when you do the random blood test, it's in the 200, it's in the 300, that is a red flag. The doctor may say to you, okay, so you come to the crusade and we do your random blood sugar and it's in the high number, and we say to you, go and see your GP. They'll say to you, okay, I'm going to order A1C, hemoglobin A1C for you, and you need to come back tomorrow and fast for this. What is this hemoglobin A1C? So the hemoglobin A1C, everybody knows hemoglobin, our blood, red blood cells, right? So there's a protein in it that attaches, the sugar content attaches to that. And that is what they're checking. So it should be 5.7%, so it's a percentage. So 5.7, anything below 5.7%, if you get your A1C and you see 5.7 or below, you're okay. 5.7 to 6.4, now that is called borderline. So when you read your blood sugar report and you see your A1C being 6.4, you got to watch it because you're borderline. Anything above 6.4, you know you're fully diabetic. So that is how your reading is. And that is the number, your A1C is the one that they use to confirm it. So the A1C, check your blood glucose over the past 3 months. It's accumulative for the past 3 months. The average of the blood sugar for the past 3 months. So within 3 months, so January, February, March, this is what we're saying. Rather than the random one, we'll just tell you right there how your body is reacting to whatever you eat or didn't eat. Okay? Any questions regarding that?
My question is, if you get that I number and you're borderline, or if you become diabetic, what can you do to change that?
We'll get into the
we're going to get that.
Let's
we're
wait
going to get that.
we get,
Any
we'll get to that.
question regarding testing?
Prevention. We
Yeah,
get
we're
into
gonna get there.
prevention.
Thanks.
So just ask question related to what?
Anything about the testing and the diagnosis or the symptoms? Anybody having any symptoms that may not be any of those that we discussed, but you had these symptoms and you went to the doctor and they said, yes, it's diabetes based on your testing? No? Let's see.
Oh, that question I want to ask. So when you find out that you're diabetic, it is telling us that the pancreas is unable to manage the amount of sugar content that is in the body.
Not all the time.
So it's producing, but it could be producing not enough.
Not
So
all
you
the
have
time.
different stages where it produces a little, And sometimes they produce none when you have to take the insulin itself, the external.
Okay, so that means then the pancreas need to be attended to then so it can be up to its maximum capacity to produce the insulin and to manage the sugar content.
All right, so let us just go back a little bit to what Sister Natalie said about our body and sugar. And all of our cells in our body need sugar in order for it to function. You cannot function without the sugar. And the sugar, we call that glucose. So everything we eat that is carbohydrate, so whether you eat a banana, you eat potatoes, you eat crackers or so, the body breaks it down into the smallest unit it can, which is called glucose, which is the chemical that the body needs. The cells use it to produce energy, and that energy is used to run the body. That's the reason why if you don't have the sugar or glucose in your cells, then you get tired and so on and so forth, right? So that's what happened. So we need, and most of the glucose is used up by your brain, all right, that you put in your body. So those of us who do a lot of brain work, I always say I eat brain food. I try to eat food so that my brain will have enough energy to work for the day. Those of us who teach and all of that, right? We need brain food. So we need glucose. So that's number one. So that's very important for us to understand that we need it. Now, what happens in diabetes, and that's where we need to talk about the risk factors. There are a number of risk factors for diabetes, and there are a number of types of diabetes. And by the way diabetes is caused is very complex. A lot of studies will tell you that it's very complex. However, this is what they have found out. So genetics is one way that you can get diabetes. So you can born without the capacity to produce insulin, and that is called type 1 diabetes. Okay, so going back to the question that you asked, Elder, so the pancreas is not functioning to produce the insulin. So that's, and it's because the gene that produces the insulin is damaged. You weren't born with it, it was turned off, something happened in your body, and you inherited that. Then that is about 10 to 14% of people in the world have that. About 10% to 14% of the people in the world have that. Now, type 2 diabetes is the one that we are here talking about. Now, that's the one we call the lifestyle and chronic disease, okay? 90 to 95% of people in the world have that. In 2019, they said about 400 and something million people in the world had type 2 diabetes. All right? Now, for you to have 41 million annually. So they were saying that by 2045, we should have about 700 million people with diabetes, in the world.
By 2030, that will go up to 51% more.
Yes. So it's a lot. So let us go back to type 2 diabetes. All right. So a number of things happen in type 2 diabetes, and one of them is called insulin resistance. Okay, that's the reason why we say it doesn't have to be the pancreas that is having the problem initially. But in resisting, meaning that the cells that are supposed to take up the insulin, right, do not take up the insulin, and one of the main reasons is because of too much fat in your body, like around your waist. Okay, too much fat around your waist, and that is even another complex issue. They're trying to understand why it is that the body resists taking up the insulin. But it does because you have that fat around your waist. Okay? So obesity is a major factor. So your body resists the insulin. The cells that are supposed to take up the insulin so the glucose can come out of the blood doesn't allow the glucose to come out of the blood. So you get the high blood sugar. So what will happen now, the pancreas now will see that the sugar is not getting into the cells, so it starts producing a lot more. And then your blood sugar just keep going up. So the 500 and odd, that could be your pancreas producing a lot more because the insulin is not doing what it's supposed to do. All right? Right. It's not doing what it's supposed to do. So the pancreas keep producing and producing, but eventually the pancreas will stop because after a while it tires out. Just like any machinery that keep working, it's just going to stop. So you can stop secrete. So one, insulin resistance, and two, it can stop secreting, all right? And then three, the insulin doesn't do the action that it's supposed to do, all right? Did I answer your question there, Elder? Right. So there are three things that will allow the sugar to stay in the blood, all right? I don't know if you want me to go any further with that. All right, but so when the sugar stays in the blood now, why do you get all the symptoms that I explained the tiredness already? Because the sugar isn't getting into the cells, so your muscles get weak, all right? And we're talking mostly your skeletal muscles get weak, so you feel tired a lot. Okay, and then your brain start acting up, so you can even end up in coma. And this is the main reason for it. When you have too much sugar in your blood is now going to consider to have less water in it than the cells of your body. So what's going to happen is that all the water from your cells, especially your brain everywhere, is just going to go into that bloodstream. All right. Now when it does that, your cells get dehydrated. That's why you get thirsty. Because they're going to tell the brain that you're thirsty. Right? When your body already have enough water. All right? So it makes you want to drink. It's going to tell your body that you're hungry when you're not, your bodies have the glucose in it. All right? And then because your cells get dehydrated, your brain cells can't work. And then your muscle cells can't work because they don't have the energy. All right? And you can end up in coma, you get confused, weak, and all of that because your cells are dehydrated. Now, the heart cannot handle all of this fluid. The body is not used to having all of that in the bloodstream. So the body and the heart going to pump, and the kidney is going to help to push out the water. And so will the glucose go as well with the water. Okay? So that's the reason why you're going to urinate a lot. And then the yeast infection comes because and bladder infection come because the sugar is going to change the environment of your bladder and so on. So you end up now, because there are microorganisms in there, what happens is that the microorganism is going to have a good time populating in there and give you infection. So these are some of the reasons why we get this is the reason why we get all of these symptoms that Sister Natalie has spoken about just now. All right, so I hope I have explained clearly how it is that we get the symptoms that we do.
Okay.
Yes? Any questions?
I see a hand up.
Based on what you just said, is there a relationship between diabetes and hypertension?
Yes, there is. I don't know if Sister Elder want me to go into that yet, the complications. I don't know if you want me to go into the complications yet.
Let's wait a bit before we get into the complications.
Okay. All right. Any other questions about?
Hypertension is a complication of diabetes.
Yes. So if you
when you have diabetes, it affects all of your organs, from your eye, your stomach, all of your organs. So that's why you have hypertension. That's why you have.
We'll get there later.
We'll get there. But
Okay.
before we go any further, I just want to give some facts that diabetes is one of the 4th leading cause of death worldwide, and that's why it's relevant for us to be talking about. We just talk about that 41 million people is diagnosed with diabetes annually, and it is predicted by the year 2030 that we'll have 51% more increase in that. 12.3% of people older than 20 years have diabetes, right? And this is type 2 diabetes. 25.9 people to 65 years or older have diabetes, right? Okay. We talk about the risk factors just now, right? And you talk about waist comfort, waist circumstances, and what should be your waist? For female
Well,
and
for
for male,
females,
remember.
it should be 25 inches, not more than.
Okay.
And for men, it should not be more than 30.
Okay.
30, 35. 30, 35. It's allowed 30, 35, not more than that.
Right.
And for women, it's 25. The ideal is 25, yes. 25 inches, yes.
I have a question.
Yes.
With the circumference.
Yes.
What about women who have fibroids? Would that be
That is
added
what.
to-
No,
that's
that's a condition.
I'm just
That's a
asking, so
different
that
thing.
would not considered in the 25?
25, no,
Oh.
because that's a different condition. That's of the uterus.
Okay.
Yeah.
All right.
It's fat that makes it more.
And,
Yes,
and
fat, fat,
there is also an exception with the waist because sometimes, based on your genetics, some women are naturally, the waist is naturally like that. All right, they are bigger. Children grow bigger. And they don't have diabetes. The adults, they are healthy. They are big in body. Their waist is big, but they don't have diabetes.
But they
Right,
are
but it's the
active.
fat content that we're talking about.
Yes,
The
they
fat
are
around your
active.
waist.
Right.
Okay?
Contribute
Alright.
both to diabetes and heart condition,
Yes.
right? A sedentary life, if you sit down too much, I did,
Ooh, don't understand what? The waist?
Yeah, that's one
Right.
of the predictors.
It's about the right. So I told you that you develop insulin resistance because of the fat around your waist. So the less fat you have is the less inches you're going to have on around your waist. So they are saying for you not to be at risk for having diabetes, your waist, the circumference of your waist should be about 25 for females and between 30 to 35 for male. All ages.
All ages. no
All
exception.
ages. That means.
And since we're talking about type 2
and-
diabetes, we're talking about the onset of it beginning at after age 14.
Yes.
All right?
All right. So we are talking.
Yes.
So what we're saying that and whenever your waist is over 25, you are at risk for having diabetes. That's all we're saying. We're not saying that you will have it or you must have it. We're saying that if your waist circumference is more than 25, you are at risk for diabetes and heart disease.
Yes. So so another thing is for you to know your BMI. Okay. So that is another way to judge whether or not your weight is within the range or within the limit that you're supposed to be for your height. Okay? So how do you calculate that? You first have to know your height and you have to know your weight in kilogram. So you have to know your height in meter and the Google can help you with that. Once you know your height in feet and inches, you just ask Google to convert it and the formula is there. So it's your weight over your height in meters squared. And if your BMI is over 25, then you are considered to be overweight. And if it is over 30, 35, you're obese. So, so one of the other ways to see whether or not you have your right weight is to do your BMI. Okay, your body mass index. All right? So for those who are concerned about their waist, also use your BMI. All right.
All right, before you come with your question, I'm going to give another risk factor. If you have a baby over 9 pounds, you are at risk for having diabetes. Okay, go ahead now.
To Sister Karen, I heard you said that if type 1 is genetic,
Genetic. Yes.
but type 2,
Type 2 can also be genetic, but it's genetic plus a lot of environmental factors.
Okay.
The risk factors that,
Okay.
so if you have a family, if you have family
Yes.
members close to you who are diabetic,
Mhm.
you're more prone to having it. However, we say that you can have the gene, but it doesn't have to get turned on,
I understand that.
right?
Thank you.
So it's your lifestyle that is going to be the factor now that determines whether you have diabetes or not. Yes. Yes.
Then, why is it that person living for years, and when they get the diagnosed and start treatment, they get sick?
What do you mean get sick? I don't understand that.
Yeah, they lose weight, they're sick because they went to the doctor. Yeah, they didn't know, and when they found out, Oh, you need to get treatment. They get sick.
Okay, so one of the reasons I can only propose this reason. A lot of times when you're told that you're sick, you'll start fretting and then it increases your stress level. Now, diabetes is one of those things that your blood sugar goes up when you get stressed. Okay? So that's the reason why we say with persons who have diabetes, you have to manage your stress level. And sometimes that's what happens. Right? So sometimes the way you deal with it mentally can determine how well you are. The same thing with cancer. You never know that you had cancer, and you went to the doctor, and the doctor told you you had cancer, and you're dead 6 months later because of the mental stress, the stress that you have no, I don't want to say developed, but you have no, well, you have, do we say we develop stress? I guess we increase our stress level.
And
I don't want to
remember,
say we develop it, but we increase it. Okay?
Some of these chronic disease can cause depression. You check a person that have go on dialysis, a person of diabetes or cancer, they go into immediate depression. I used to be depressed even hearing about diabetes because the first person I see real with diabetes, I tell myself I don't want to have diabetes. My mother, she didn't know that she had diabetes, and she went to New York, and she went into diabetic ketoacidosis, and she was admitted in the hospital immediately, right? And I was the only one with a visa, Natalie, and within 1 week I get gray, yeah? That's the effect it might have on some people. Within 1 week, all my hair turned white because of the stress. And I always say, I don't want to have diabetes, but sometimes if you don't, and you do everything, you still get it. Okay, so, and some of the drugs them that we take can induce diabetes, like steroids, like the blood to lower your cholesterol. Yeah. So they ever saying, yes, if you do, you die. If you don't.
And even some salbutamol that you use for asthma, yes, that can induce it too. And what you use to treat goiter, thyroxine, yeah, that can cause diabetes too. So, yeah.
Okay. Yes, go with your question now.
Yes, I was going to speak about the medication that sometimes the medication that you take give you another disease. You're trying to prevent one or to keep one at check, but you end up with another one. Like if when they give you some medication, you end up with yeast infection because they should give you another one to prevent the
fungal, antifungal,
right, and to keep the good bacteria inside. And so you're treating one, but you're gaining another one. Also, with diabetic
sorry,
patients,
can I just say something about that? Usually that happens with antibiotics. What happens is that when you take some of these medication, it does what we call change your normal flora.
That's what
now,
she was
we
saying,
have
though.
bacteria, fungus, and everything on our skin. God put them there for a reason. And it is to protect us from the more dangerous one giving us diseases. Now, when we change like the pH, right? When we change the pH of our skin, we ended up with skin infection. When we change the pH, like in our urinary tract or vaginal tract and so on, we end up with infection because the normal bacteria that is supposed to be there protecting that environment is decreases, and then the one that can cause disease increase because of the pH in there. So that's what is happening there. So yes, that can happen. That's the reason why you're encouraged to take a lot of fluids and so on. And not only that, but we have to protect ourselves with lifestyle things, right? But I want to say something about medication, though. We want to be very careful about medication. We advocate that you take care of your body so that you don't have to take medication. However, when you're in a crisis, that's not a time to tell yourself that you won't take medication.
Like when you have a 525 milligram deciliter of blood sugar in your blood.
Yes, that's not a time to tell yourself that you're going to take herbs, because the herbs are not going to work as quickly as the medications will. So there's a place for medication. But more importantly, It's the lifestyle that you need to change. So when your blood sugar, when you're on the medication, you try to get the lifestyle in control, back on track, so that you can lessen that medication and even come off it. But it's not a time to tell yourself that you're not going to take it because God don't want me to put these in my body. But guess what? You already damaged the body, and God gave the knowledge for the medication. So what are you going to do? Right? Electricity out there damage our body too. Did you know that? Right, but we use it every day, and the cell phones do too. So we have to be careful about, and that is my main concern about our church and our people and so on. There's a place for the herbs, there's a place for the medication, but we need to know where to put them. And quite often we are destroying our body temples by not taking those medications.
Okay, I think, Natalie, you wanted to say something? But before you go, I think Wesley has
I think Sister
no,
Selena has something else to
Wesley
say.
has his hand up there a long time. So like Lucy gave. You never finished?
No, I was just clarifying something she said. Yeah, so let her finish.
For the diabetic person, sometime when you have it and you normally do sometime a urine test, some person doesn't have it in their urine and they keep testing and it doesn't show. Like my mom, when she had diabetic, she didn't know because they have the tablet that they put in the urine. It didn't show, it only showed in her blood. So she was getting sick and we don't know what was wrong with her because the nurses are doing the urine test, but it's not showing that she's diabetic.
That did not happen here though.
No, I didn't say here.
What type of urine test? Was it just the dipstick?
They had like both tablet and something and the dipstick.
Oh, the tablet form.
And it would not show that she have it. And until they had to treat her for something
that reagent
different.
is not strong enough for...
Please, no, we don't measure you. We measure for ketones and proteins and that things in your urine. We don't do the sugar in the urine.
But if I...
No, they're talking about the tablet, the one that you put in and it turns blue. Yes, that one. I don't know if they still use it, but she said they've tried.
Please get your glucometer reading and do your blood sugar, yeah?
But
yeah,
I'm not talking about not stuff. I'm just saying because a person could be doing it knowing that they have the tablet still out there, that they have the tablet and they have the injection. They take it to the...
You mean the strip?
The strip.
Okay.
Right, so, and also, you can clarify this for me. Some person, when they find that they have sugar, they start going thin. And some person just blowing up like a balloon. What caused the difference? Why one gets so thin and one gets so big?
Okay, well, that has really to do with the stage of the disease that they're at.
And how their body reacts to it too.
Yes. So the stage of the disease that you're at can be a factor. So your body is breaking down the fat. Sometimes when your blood sugar is so high, what happens is that your body start break down the fat, and then it breaks it down very quickly. And that's the reason why you can end up getting ketoacidosis, because the ketones build up in your body, and then you get, it's very toxic to the cells of the body, and you can get sick. So for some persons, that's what can happen. All right?
Okay, what I had to say was that on the same point that you're making as it relates to why some persons actually lose weight, metformin is one of the medications, correct, that is normally taken for individuals who are diabetic. For some individuals, or a lot of individuals, once they start taking metformin when they have type 2 diabetes, they start losing weight and lose it quickly as well. As a matter of fact, some persons who don't have diabetes take metformin to lose weight.
Yes, that's true.
So that is one of the reasons why persons could lose weight where that is concerned. The other thing is that my brother at the back mentioned, well, we also mentioned as it relates to the waist size. I was surprised about 3 or 4 years ago when this gentleman used to do work at the office, the car wash man, and this man's waist was below 30. He was probably about 20, somewhere between 28 and 30 there about. But surprisingly, he went to the hospital for not feeling so well, and when they checked him, he was diabetic. and not long after, he went back home and he died. Now, the reason I mention that is that I know that the panelists have mentioned this already, that this is a guideline. So if your waistline is 25 and you're slim, it does not mean that you cannot be diabetic or you will not be prone to be diabetic. It comes down to our lifestyle, the foods that we eat, and even if we are working hard and sweating every day in the sun, it doesn't necessarily mean that we will not necessarily, that we won't get or we will get diabetes. It just means that, as Elder Fletcher mentioned, when the checks come around, the checks are free. Just do the test, because you never know, as well as you're feeling, it just might check out that, yes, you are borderline or you are full-blown diabetic.
Yes, that's a very good point, Elder. So I just want to reiterate a point I had said earlier, that, that the risk factors or even the cause or the way diabetes happen, it is something that is still being studied. All right, it's something that is still being studied. Some of the causes are unknown, are still unknown. But these are when they do the studies, what we have mentioned as the risk factors, these are the people that they're seeing diabetes in mostly. Okay, so this is how they come up with the risk factors.
Okay, all right.
And talk about fat, just to say about mention about fat, it is not just what you can see or your waist getting big. It's talking about also the internal organs, like your around your liver, you can have fats around there. You can have liver right there around the pancreas. You can have fat. So the fat can be concentrated where you cannot see outside. So it's not that your waist is getting, but because fat is in your body, and then that affects how insulin operates, then it affects you and you get the increased sugar in your blood as well. So that's hyperglycemia, yeah. So all of those things happen, and so we can get to the complications in a bit.
Go ahead, Natalie. Natalie wanted to say something long time ago.
No, I think Brother Colley answered the question as it regards to losing weight once you get diagnosis, and some of the medication actually contributes to that.
Yes.
That's what I was going to say.
Yeah.
So we're still on risk factors: smoking, dyslipidemia, if you have too much fat in your blood, right? And some people very slim, but they have a lot of fat inside. I don't know if you ever kill fowl, and when you kill the fowl looks slim, but when you open the fowl, there's fat all over the place. You have to scrape out all of those fats because there's fat. Okay, so are we now at the complications?
I think if we understand the use of insulin in our bodies, yes.
I just want to say something. Persons here are acquainted with diabetes. You have anyone that you are acquainted with also, so your person might personally have it. Do you know anyone that have it?
Do you have it?
Huh?
Do you have it?
Well, I don't know if I have it. I don't think I have it.
You don't think
or do you have it? Yeah. So many of us are acquainted with persons who might have it. I know for the children who are here, we are talking and you might not understand. But Brother Colley, did you get that video, that slide that I sent to the chat? I don't know. They might get a picture of it if I play this video. It's a 3-minute video. So I think I just play the type 2 alone. Yeah. So it's about a 3-minute, but I will continue to speak about the complication until you find that video.
Before I get to the complication, I just wanted to say where insulin actually acts. Mostly where the insulin, as we have said, is a hormone, right? And it leaves the pancreas. And there's a particular cell in the pancreas called the beta cells that produces the insulin. So when you eat, what happens is that the glucose content in your blood will go up, and the brain will tell the pancreas to produce the insulin. Now, when the insulin is produced, it is supposed to drive the glucose into your cells so your cells can have energy to work. Now, if you have, and the excess now will go into the liver. Now, the insulin will stimulate the liver cells to convert the glucose into what we call glycogen. And this glycogen is stored in the liver, so that if you're starving, you know, like when we're fasting, When you're fasting, that is how our body get back sugar, glucose, so you don't fall down while you pray and all of these things, right? Right. So the glycogen is stored in the liver, and it is also stored in the muscles, in your skeletal muscles, right? In your leg muscles, thigh muscles, and so on. So it will convert it to what we call glycogen, and it is stored there. And then if the stores are full, can't deal with any more carbs, then the insulin is going to, the liver would have changed it into fatty acids. The liver would change the glucose into fatty acids, and then it will go into your fat cells. Okay? So your fat cells, your abdomen have a lot of fat cells, your hips and your thighs and so on, your arms, that's where it is going to deposit now as fat. All right? So whenever you are fasting, then the body will convert back now. It has another hormone produced by the pancreas that will convert that. So when your blood sugar get low, then the pancreas will convert that back now, that glycogen back to glucose so your cells can get the glucose, right? And if you're starving for too long and you lose all of that store from the liver and all of that store from the muscles, then it start breaking down the fat. All right? Start breaking down the fat, and that's how people will lose weight. Okay? So that's what will happen.
That's the process in intermittent fasting.
Pardon me?
Is that the process in intermittent fasting?
Intermittent.
To lose weight?
To lose weight?
Yes.
Well, it would work. The same principle would suffice. But people who eventually starve themselves for like 40 days and more, that's the reason why Jesus was basically skin and bone. Listen, when he finished fasting, he was weak, and because his body had already used up the glucose store. So this is what had happened to him, and so he wasn't totally skin and bone, but he was weak, and he had lost a lot of weight. He would have lost a whole lot of weight. All right? That's why he was offered bread, yes.
Well, okay. Moses fasted for 80 days. 40 days, and he went down there and showed down the law, and then he went back up there 40 days again, so that was 80 days.
Yeah, Jesus' fasting was totally different. Yeah. What's that? 40 days you would die, right? You would die, sister. If you do it now. Well, Jesus did it.
Okay, are we getting the video now? Yes, let's get the video.
Yes, so just to get a clearer picture, when you look on things, you kind of can get a view of what Sister Karen was just saying about the pathophys.
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin.
You want to start it from the
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin.
I'll just talk a bit, and then we'll show it at the end, all right?
Insulin.
Oh, you have it there. Okay. I just play it like that, small video, without the slideshow. Just play it as it is. Anyway, so with the complications, we have heard about 2 so far, 3. We heard about diabetic ketoacidosis. We heard about...
that one mainly comes with type 1 diabetes, though.
Yeah. So, but we have a few that...
Yes, they do, but it mainly comes with type 1. Yeah, it's not quite often you'll see necessarily a type 2 diabetic with that.
All right, so we'll just
About
go back to
90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating type 2 diabetes. Some people can manage it by healthier eating, being more active and losing weight. Eventually, most people will need medication to bring their blood glucose down to a safe level. Whatever the treatment, everyone with type 2 diabetes needs to learn how to live with it. We help people do exactly that. Take a look at our website to see how we can help you. Our researchers are also investigating ways to put type 2 diabetes into remission, so people's blood glucose levels return to normal and stay there. And they're finding out more about type 2 diabetes, so that we can do more to prevent it, find new ways to treat it, and one day find a cure.
All right, thank you so much, Elder Colley. Yes, so I think that video kind of give you a little peek at how it works, especially in our body. All right, those doors, I think you will understand. That's what insulin does. It's like a carrier, and it helps to open the door so that your cells, so that it can go in the cells and don't stay in your blood. Right? In other words, the sugar leave your blood and go straight to your cells so that the body can use it. Okay. So the complications that arise now, we talk about something that we called earlier that might cause hypertension. And now how it causes hypertension, which is a cardiovascular thing, it is something that we call plaque formation, and that is atherosclerosis. But atherosclerosis would occur after possibly arteriosclerosis, if I'm correct, but you can give me the pathophys. So, so where in the body builds up plaque. Plaque formation is occurring, and that only occurs because your blood have to start pumping extra. In other words, it starts your heart, or through your vessels, your vessels is getting narrowing of the arteries is arteriosclerosis. And then atherosclerosis is the plaque formation. And so the plaque formation would occur because your arteries get narrow, and then atherosclerosis occur because your heart is trying to force the blood through your artery, and then it's kind of scar the sides of the artery. All right? And then when it scars, our bodies heal itself, just like when you get a cut. So it's heal it, and then it causes these plaques to be forming. And it still gets narrower and narrower. So both of them occur together, and it leads again to increased blood pressure. Yes.
All right. I want to just explain a little bit about why you get the blood pressure. Because that's what you wanted to know, right? Because the insulin has something to, insulin is very important to the kidney. As we had said, the cells in the kidney need, in all organs, need insulin. Now, there is a special system in the kidney that actually affects our blood pressure. It's called renin-angiotensin and stuff. Even our lungs have something to do with our blood pressure. So when the kidneys get affected by insulin resistance, then it can affect this pathway that we call renin-angiotensin pathway, right? And when that happens, then our blood pressure will go up. Once the blood pressure goes up, as Elder says, then this is going to put problems on the heart, okay? Because it's just like with any pipe. You put a hose and your constant pressure in that hose is going to cause tears in the walls of the artery. Now, because those tears, because it's forcing, our blood vessels have different layers in them, different layers. And when the blood is pushing at a certain force, it is going to cause them to tear, like Elder says, okay? So when it tears, not necessarily the outer wall, because if the outer wall tears, then you're going to have hemorrhage, right? And that is when we can get stroke, because our blood vessel bursts, yep? So the little tears will cause plaque, like fat, and so on, to get stuck in those tears. And that is when your artery starts getting start narrow because of all of those fat, those plaques, and stays in there, okay? And then it can peel off, yes, after a while. The blood coming through, rubbing it, the plaque comes off, and then it can block your artery. It just moves along and block it. And a lot of times, it loves to go to your heart vessel, and that is supposed to supply your heart, and the ones that are supposed to supply your brain, they love to go lodge. And also, they love to, sometimes they go lodge in your lungs. But the heart and the brain is where they like to go, and that's where you get the heart attack. So we say you get the heart attack or coronary artery disease, and you get stroke. And why it's called ischemic is because when it blocks, the blood cannot go there, so oxygen and nutrients can't go to your brain. Okay, so when oxygen can't go, all right, so this is another thing I need to tell you, that oxygen plus glucose is what gives you energy. So if you have no oxygen, you can't have energy either. All right? So what is happening there? The stroke just means that your brain cell die, because they need the oxygen and the glucose to provide the energy, so your brain cell will die. And your heart must die. That's the reason why you get the pain, the heart attack, and the stroke there. All right? Mm-hmm.
Can it go the other way around? Can you get the hypertension first before would it still be the same thing, or would it be something different if one appears before the other?
Okay, what studies have shown is that there is no real link between hypertension going to diabetes. Yeah. There are a lot of studies that are showing that, but they say that they need to study it more, but it's still, there are a whole lot of studies they have done. And no recent study is really showing that hypertension leads to diabetes. It's really the other way around.
I just joined the online chat a while ago, and Sister Karen Hall, the other health professional nurse on the team, she has 2 points. One says that if one of the other factors or things you can look for when a person is diabetic is a change in the color of the skin. So the skin might get darker. I believe that's why she's probably around the sides of the face and also on the rest of the body. And around the neck as well, they're saying, okay, skin get darker. The other point that she's making is that, okay, she was also making a point about medication, how medication can affect how the diabetic condition. But I guess she's talking about whether you lose or gain weight.
Okay, wonderful. So going back to what Sister Karen said about the skin changing color and all of that, that has to do with the fact that hyperglycemia affects, and we're talking about the blindness. We have what is called macro and microvascular damage. So the high blood sugar is going to damage your small blood vessels, the very tiny ones that you can hardly see. Those are called the capillaries. And that's why you're going to get inflammation on them, that mean that you're going to get swelling and redness and so on. And eventually they're going to scar and then lead to the same problem where they can't get the oxygen and the nutrients, and then you go blind. So the blindness comes from the small vessels now being damaged. And then you have the large vessels now being damaged, and that can mean the kidney and so on. So your hair and skin get affected because of, once again, the microvascular. So if your hair can thin, fall out, be fragile, because remember, you need a glucose in all of these areas, so you're going to get a number of issues happening. All of your organs can be damaged because of a high blood sugar, but the main one one of the main ones that is going to damage is your kidney. I mean very quickly. Okay?
Prevalence of stroke as a result of being diabetic. I know, for example.
That's what we just mentioned.
Right. I just want to give an example. I learned this afterwards, after coming here. My father was diabetic, right? I won't go into the whole story, probably coming to the end or some other time. But my experience on what I did to prevent myself from going along that line. But he was diabetic, and he had what we called a diabetic stroke. What was mistaken for low blood sugar. So when it happened to him, I wasn't there, I was at work, and when I heard about it, it sounded as though his speech was slurred, and he was a bit confused. But by the time I got to him, about 45 minutes later, his condition was almost back to normal. You were speaking, he was all up and about and doing well. They gave him something sweet or something to that effect, believing that was the situation. What I learned afterwards was that what he actually experienced was a transient stroke, and that it happens and within 20 minutes to half an hour, the person is back to normal. However, the long-lasting effects of that is where the real damage happens. If the person doesn't get help or treated within 2 to 3 days, the long-lasting effect can be very detrimental, which is what happened afterwards, because later on he became, in a short space of time, he started losing his memory, and he eventually got into other complications. So it is very important for us to be aware, not only for ourselves, but for our loved ones, our father, our mother, our husband, or wife, or even our children. We need to be aware of the symptoms and what we can do at the time when these symptoms occur to help the individual and or ourselves to get over these symptoms as best or as quickly as possible.
Okay. All right, good point. The transient ischemic attack it puts you more at risk to really get a stroke, all right, a full-blown stroke. So you can get them in short succession. And that's the issue with transient ischemic attack. So you really have to understand what is going on. They have to do all the diagnostics to understand what is going on with the person and to treat promptly so that you don't keep repeating those attacks or get full-blown stroke. All right? Insulin is very important to our memory, us being able to remember things, us being able to have good thought. It's even implicated in Alzheimer's, right? Diabetics having Alzheimer's and all of that because of hyperglycemia and the cells not getting enough glucose to it.
Okay, I'm looking at the screen and I'm seeing things there.
You see
that,
what?
like the stroke, the heart, but I'm saying a person can have those and not diabetic,
If you can
Or-
have them without being diabetic, yes. Yes.
And also
Yes.
high blood pressure.
Yes. So that's the reason why when you go to the doctor, they have to do all the diagnostic tests and get the history from you in order to find out exactly what is causing your illness. So that's the reason why one medication doesn't go for just because you're having headache and I'm having headache doesn't mean that we're having the same cause for our headache, and therefore that's the reason why it's important to get the right diagnostic workup.
Okay.
We can go to the next slide for the other complication. So these are some, and you have these are those cardiovascular problems. But they have
So
mentioned
you
the others
can
as well.
go to the next slide, Brother Colley. Any other questions in the meantime? Right. So that's the one, the number 2 on the list that is really affecting us right now. I must tell you seriously, when I came here 6 years ago, because I have to go to the dialysis unit with my students. And when I came here, the number between the last time I went, when the first time I came and now, the number of persons on dialysis have basically almost doubled. Right? Are basically almost doubled.
And a lot of them are young people.
Yes. And when you find out what are their problems, diabetes and hypertension. That led to them having
So
renal
1/3
failure.
of the patients on dialysis had diabetes, 1/3 has hypertension, and the other third is other causes like stroke and SLE and things like that. But so major factor for renal failure is diabetes and hypertension.
I already explained the retinopathy, the cataract, glaucoma, and of course cataract. Well, it's usually glaucoma that you get. What will happen is that eventually the retina start peeling off. That is where all the light hits the retina and then converts it, and you can see the picture. Now, if that gets damaged, then you don't have any sight. All right, so it can bleed and so on. So it's called the microvascular damage. So you go blind, and glaucoma is what you get, and it's not reversible. Cataract, you can get cataract from other reasons apart from diabetes, and you can have your sight because they can remove your lens and so on. But glaucoma, once you have it, you're blind forever, and it does not, so it cannot reverse.
They must go over the glaucoma again.
In terms of?
Oh, it is from the
Because of the damage to the small vessels, okay? So it damages the small vessels, the retina will start bleeding, the retina gets damaged, and because the retina is damaged, vision is damaged, right? The pressure in the eye will go up, yes. The pressure in the eye will go up from that as well. Because you can have, when you have the inflammation in the small vessel, what will happen is that when it heals, because it is called chronic inflammation, when it heals, it hardens, and then it narrows, and then you increase the pressure, yes. All right, and then it damages the retina.
Okay, I think we are almost 5:45. What time is AY finished? We don't want to go overtime. Okay, you have a next slide there. With
Talk about the neuropathy, because the nerve damage. Because that is what is causing everybody to lose their limbs.
The persons may not be able to feel. Sometimes you're walking or in your house and they walk their foot, they don't feel anything. They just know that they touch. Yeah? Yeah, a nail, they don't feel anything. If there's something hot on the floor or even on the stove, sometimes they feel their hand go against it, they don't feel anything. So that's nerve damage. And then at the end of the day, there's going to be further nerve damage to your nerves. And then you're going to have to get treatment for that. Sometimes it gets so bad that it can't even be, treated or patched, and sometimes have to take other aim like grafting to try to correct the issue. But so that's a problem, the nerve damage area. And then we have the other complication include skin. We talked about the skin earlier. Skin damage, hearing loss, and yes, depression, sir, and dementia. Yes, so some persons, because of the depression, they might gain weight, and because of depression, they might lose weight. Okay.
Okay.
Just a quick thing. Just want to interject that even though we went through the nerve damage, we have to be mindful though for those who are diabetic. When you go get your pedicure, you have to make sure that somebody know that you are diabetic, because just a simple nit or cut on their nail or something, because I've seen it where a patient comes in and eventually lose a toe because of a pedicure. So you have to ensure that that person who is doing your nail care knows what they're doing and know that you are diabetic, and you have to inform them.
And you must always, if you're diabetic, you must have a mirror that you check your foot, the bottom of your foot, every day before you go to your bed. All right? Because something may nick you, you don't know. And if you catch it early, you can do something about it. But when it gets too far, you may lose your limb. Okay?
Right. Okay, I was just going to say that you lose 1 toe, 2 toe, 3 toe, 4 toe until you lose below the knee or above the knee amputation, right? And some people I have seen diabetic and they don't want to amputate their foot, and then the whole body gets septic or poison, and they die from it because they don't want to remove it. Yeah.
Yes, because, and gangrene usually, that kind of thing usually signals each cell. Yes, there are 2 types of death, that your cells can go through. So when I talked about the one the one that when the pancreas keep working, or when the pancreas not used anymore, then what will happen is that those cells in the pancreas will die. No, that's not necrosis, right? That's not gangrene. That they just die a natural death. When our blood cells, every 120 days we lose, our blood cells change, okay? And that is important for our bodies to continue to function. So some things just die, the body gets rid of it as waste. But when you get the gangrene now, so that signal doesn't move to the next cell. But when you get the necrosis now, it tells the next cell to die, and the next cell to die, and the next one. And until your entire body dies. Yes, it just keep moving up your body.
Okay, I think we almost, before you come, we'll take your answer, but we need to go into prevention after this. And then we while this evening, because I see it's dark out there already. Okay? All right. So, yes, brother.
But this is not from me. This is from your other partner. Sister
Okay.
Hall
Yeah.
is mentioning another point where she's saying that there's another thing with diabetics in diabetes patients in Cayman, is that there are a lot of ulcers that occur. They have
A lot of what?
ulcers, patients with ulcers as a result of being diabetic. And and she just adding to the point where a person should always wear comfortable shoes and so on once they are diabetic. And just to add to that, one of the reasons where persons tend to get cut and don't know is that they have lost feeling because they are diabetic. So hence the point where Sister Jones is mentioning that they need to check themselves at night. And also when you go to your pedicure, your pedicure, you will not feel when you get stick. And as a result, the wound the little prick develops into a wound until you lose a toe and hence the foot and so on and so forth. Yeah.
All right, thank you, Karen, for that. Karen online for participating in the discussion. You should have been right here up front. Okay.
She's still here. She's doing well.
All right, okay, so let's go into some prevention now. Prevention. I know one thing you can't prevent is your genetics. I can't prevent how old you become. Even if it just look like age, huh? Genetics, inherited. You can't do anything about that.
You can't do anything about what you inherit. If you inherit a broken cell, it can't be fixed. Nobody can fix that.
Okay, they say that once you have a parent that have it, then you're gonna have it, or if you have
may have it,
or big babies. So I'm just saying that why I'm saying that you can prevent it is you put the food in your mouth. So I believe, because, for instance, they believe that I should be diabetic already because all my babies are big, and I tell them I won't
All
become
of your babies over 9 pounds?
10 pounds. So, and I'm telling them I'm not going to become diabetic because I am putting the food into my mouth. So unless it's going to come some other way, because you have time when I just decide that I'm not going to do no starch, a simple little starch. The only problem I have now, I can't take the vegetable because of blood clot. So I wanted to say to you some more. When I see the ischemic there up there,
Ischemic stroke?
Yes, when I see it there, because upon giving birth, I didn't have high blood pressure, I didn't have sugar, but I end up with thickness of blood while twin pregnancy, and they were just saying here it's because of twin pregnancy why I'm having all these symptoms, but they don't know they didn't say until I was about to give birth, and clot went to both lungs, and so I end up with the ischemia, which give me the strokes, which give me the memory loss, the long term and short term, and the heart problem, which heart stop altogether. So I'm saying, didn't have those problems, didn't know how any problem, but then that comes. So
Yes, diseases are very complex, sister.
I just
And
remembered one
yes.
that you mentioned, pregnancy, gestational diabetes. How does it relate to type 2 diabetes, if at all?
Well, gestational diabetes is another type of diabetes, but it can lead to type 2 diabetes. They have seen it. I'm not sure exactly the pathway in which it does, but they have seen that persons who have had multiple births and have these episodes, they are more risk for type 2. But like I said, the way these develop is very complex. So these are some things they're still
More
studying.
questions than answers.
Yes.
as you mentioned that, because I asked the doctor, how did I come? Because I want to make sure I get my children tested since I suffer from blood clot. And they did that before, and it's not like a family thing. It's just a pregnancy thing that they would say it's a one-off. Because I'm a medical person, they said they use it like, for instance, you have, in your pregnancy, you become diabetic, or you have high blood pressure. It's the crossing over. For instance, it will say, like, for instance, is our left to right crossover is temporary, or right to left is permanent. So depends on how you cross over. During that stage that you're in, you become permanent or go back to normal.
Sister, it can be very complex.
Yes, I don't understand.
Yeah,
So
yeah. When
that's
I was
What's over there telling you about has to do with the chromosomes and
right. So that's how I become
yeah.
with permanent in what I have, because here
Yeah.
they didn't know it's still not a temporary stuff, but it was there.
Yeah,
Permanent.
but it's sometimes it is the gene might be there, but it doesn't get turned on until certain activities in your life. Sometimes it's age, sometimes it's your lifestyle. So listen. There's one thing that we need to understand is that every single one of us sitting here have some what we call mutated gene. Every single one of us have some defective gene.
Defective.
The fact that we're born into this world of sin, we all have it. We all have them. All right? We all have them, but there are a number of things that may turn them on. And lifestyle is of course a major factor.
So let us go into prevention now, because we could stay the whole day and talk about diabetes. And when you talk about pregnancy, have you ever heard about toxemia of pregnancy? Toxemia of pregnancy? Even though they say pregnancy is a normal process.
Yes, it's a normal process.
It's a normal process, but some people really get into a real problem when they get pregnant.
That's right. Yeah.
Yeah, so let's, Natalie, you want to start on prevention?
Well, the first prevention is just lifestyle changes. Exercising, watching what you eat. As you said, some of us are genetically disposed to diabetes, so it's just watching what we eat. My grandmother is diabetic, my mother is diabetic, it goes right along the line. So all of us at some point is touched by, but again, just being mindful of what we really put into our mouth, and definitely that our body is the temple of the Lord, and just making sure that whatever we put in will not cause harm to it.
All right, let's go to Brother Turner. Sister Karen has been talking a lot, so that's why I'm starting on you too.
Okay, so basically, Sister Karma said it. So it's a New Start program, and we it is best advised that you check with your physician, do your regular screening, and so that you may be able to identify diabetes if it's early. You know, so you can identify if you know you're having some symptoms, you're constantly thirsty, you're constantly going to the bathroom, and you're constantly tired. You know that these are warning signs. So do something.
We call
and check up.
the polycisters.
Right. Okay. The polycysters. So the main thing to prevent it though is really following the Adventist kind of teaching. What do you call it? New start. New start. All right. So we practice proper nutrition. We do exercise. We make sure we have adequate sunlight. We make sure we do what? A at S N E W. Yeah. Water. Yeah, have water, and we have air, and we have our rest, adequate rest. We practice temperance in what we eat, everything that we do. Make sure we're not having too much carbs, especially the simple sugars into our bodies, and things should look up for us, you know. It should look up better for us. So these are our main thing, and two, diabetes is reversible. So it should not be something we are trying to prevent. If you do have it, it's no fret, don't fret. We're not sending you home fretting. You can be able to reverse it, some of the diabetes, but I know that treatment is, for some persons, they will have to continue with treatment. But once you continue with the first line of treatment in terms of how far the diabetes have gone, I think lifestyle changes can continue to control the rest of the diabetes. Yes. Yes, Sister Tudor.
Yes, on the matter of complications, so Sister Natalie mentioned about what you put into your mouth or what you eat. So sometimes, and I've often heard that person says, you know, I don't eat any sugar, I don't eat sweets, but the misconception is that it's just like cakes and those sweet stuff that we call sweets. But we have to be mindful that the amount of carbohydrates, or we say starchy food, as Caribbean people, we like our yam and our dumplings, our bananas, a lot of rice, and we can't just eat one piece. We have to have a mix of everything or a lot. So that is something that we need to be careful of, how much starch you're putting in at one time so we don't overload the body and it cannot manage at that point in time. So we just need small portions. Temperance, as Brother Andre mentioned, in everything. Especially for women as we get older, what you find is that the hormones that, you know, we depended on over time, those are lowered, and those put us even at risk too, because then we don't have that high metabolic rate. We tend to put on the weight, or the fat around the waist, and then that's a predisposition for diabetes. So reducing your stress levels helps to minimize that fat, right? Exercise, you sleep. A lot of times we undermine the power of sleep. If you don't sleep and you're stressed, you tend to eat more calories in the day, and you tend to eat bad calories in the day, right? So you want to grab something sweet, that's not good for us. And so we have to make it a balance. The exercise is important, right? Getting up early, and I go back to it, we cannot do this on our own. If we've been in discipline for years, we have to go back. We have to go to Knee City. We have to get that help, because you can't do it on your own. Today you say you're going to fast, and it's 10 o'clock in the morning, you're wrong way, wrong direction, all messed up. So we have to start with prayer. We have to ask God to help us. And for those of us who, you know, we might not have diabetes in the family and we think we're free, sometimes things happen. It's not the way you eat. Sometimes other factors bring on different diseases. So we have to be mindful in a holistic way that we try to prevent it, because diabetes, hypertension, renal failure, I fear renal failure so much. And in fearing it, I have to say, okay, diabetes, I don't want that. So it is a triple effect, right? So if you can live healthy, let us not, there's a saying that let your food be your medicine and not your medicine be your food, right? Because sometimes we hear people saying, oh, I have to take 10, 20 medications. That's just horrible for me because I can't remember to take one, much less. So let us try and eat healthy, live healthy, and sometimes what is the biggest problem for some of us is the stress factor. The stress factors that sort of throw us off most times. So be wary of that.
Well said.
I just want to add that we're talking about managing weight. And really and truly, you know, God gave us an amazing body. Let me tell you something. Man will never know about this body. When David tell you that it's fearfully and wonderfully made, just understand it. The more you read the scientific information, is the more you understand that we don't understand this thing. And man is still trying to learn about this body. And God is going to only give us enough. God is only going to give us enough. And that's the reason why I was pushed to even make that presentation at the crusade at Lion Center, that we have to be careful what we read. And we must look, we must understand that there is information and there is information. And we must evaluate the information we get, even if it's from our neighbor and our families who have good intentions. We have to evaluate those information. All right? And the Bible tells us that is what is excellent. That we must think on the things that are excellent. All right? So we need to look for excellent information. All right. So having said that, the truth is that the only organism, the only thing in this world that makes its own food is plants. The rest of us have to eat it. We have to get it and fix it and put it in our mouth. So we are the ones who are in control. Sister Kuda mentioned the fact that we have developed some bad habits, and only the Holy Spirit, the power that Christ can give us, can help us. And that is true, very true. And we have to yield ourselves to the Holy Spirit to help us to change the bad habits that we have. But one thing that I know about this body is that it can tell you what is going on if you pay attention to it. You can know if you're eating too much or not. No, because you see the weight packing on, so it means that you're eating too much. And when we say eat too much, we really mean that you're eating too much carbs, because I just told you that is the carbohydrate that is going to make you have the fat, right? So that is what you need to watch out for. Your body tell you, I'm putting on weight here, you get up one day and you feel here and it's bigger than yesterday. You have eaten too much, so you need to lessen the amount of food that you are eating, because you're eating too much. The fact is, we are supposed to eat for the work that we have to do. So the food we eat is supposed to be used up in the work that you do, and then you put it back the next day to do the work that you do again. So if you find that you're packing on too much, you have a problem. All right? So our body, listen to your bodies. Listen to your bodies. Every day, make sure you have some time. Stand up in front of the mirror and look what is going on with it. And listen to it too. Are you having any pain, ache here? What is happening? Yes? And the first time you start feeling that and it seems as if it's getting worse, don't wait until it gets to a point where you say, no, sir, you have to run now to the doctor. That's not supposed to be. All right? So God has given us this marvelous machinery. We need to take care of it. And we need to listen to we need to look, we need to listen to what is going on with it. All right? So control our weight, very, very important. All right? Yes. And extensive diet. Yes, that is the control of the weight.
Okay, so I just want to give a few, maybe 1, 2, 3 tips about controlling our weight or controlling what we eat. Your brain takes 20 minutes to recognize what is in your stomach. So if you eat slowly, you will know, your brain will trigger when you need to stop. When you're eating and you feel full, don't continue to eat. You know, we have a saying in Jamaica, sir, before food waste make belly bust, or something like that. don't do that, right? After you each meal, take 15 minutes walk, right? What we call that digestive walk, right? That will help. Go along with that, movement. Movement is not just exercise. Your bowels need to move after each meal, right? Some of us go once a week and say we are boastful about that. But every meal you eat, you should have movement. So movement, you're walking and movement, the stool need to come out of your body. The refuse need to come out of your body every day, right? Some people, they normal for them once a day. Some people normal 3 times a day. Sometimes some people once, but once a week is not good, okay? Right, so those are important things. Have your digestive walk, eat slowly, and you eat the food in your mouth until it becomes liquid, yeah? We'll need some discipline in order to do that, right? All right, and Sister Karen is talking about the water that if you're drinking water before you eat, it must be at least 30 minutes before you eat and 2 hours after you eat. You drink water. Don't mix the liquid with the food.
The one I was saying.
Which
The
one?
one I meant to say is that if after 2 hours or 3 hours you have eaten and you still feel hungry, drink some water.
Okay, yeah. All right, so if you feel hungry, drink some water. And if you're still hungry, that means you're hungry. Yes, that's true. Yeah, if you feel hungry, drink some water. And if you're hungry, still, you eat. All right, the last point now, and I say, Miss.
No, I don't want you to move. That's why I'm standing while you're talking. I don't want you to move.
You don't
Continue.
want me to move? Okay, all right.
Continue.
All right, go ahead.
No, I just wanted to share these 2 points because I think they're important. One has to do with what I did when I found out that my father was diabetic, right? I didn't know that I could drink tea without sugar. The day I found out that my father was diabetic, thanks to my biology class all the way back from grade 9. I was 17 at the time when I found out. And I decided that, look, I'm not going to drink my tea with sugar. I used to love things sweet. And when I found out what diabetes is, and I won't get into that because you have done a great job in mentioning that, I decided that I'm going to start by not drinking my tea or even having juice, boxed drinks and stuff like that. My philosophy after that was, if it is not going to help my body, I'm not going to do it. I'm not going to use it. So boxed drinks, soda and stuff like that, sweets, they were all cut out.
I hope you don't buy any of those in your home.
No, I don't. So, and to this point, and even to this day, when juice is said that it is good because it is healthy, it comes from fruit. But at the same time, it is the sucrose that's there, the high concentrated sugar that's there that creates an amount that you drink at any particular period in time that creates an issue. So the point is, the other point I wanted to make was that us men tend to have this situation where, and I'm using this example from my experience that I had with my father when I was growing up. My mother is a nurse, right? And he wanted to have her be the one who is, how should I put it, responsible for what he eats and what he drinks, takes care of his diabetes for him. So when he's at home, what he would do is that he would adhere to what needs to be said and done. But when he's on the road and she's not there, whether it is, before it came on a Seventh-day Adventist, whether it was beer, whatever he would drink or eat, he would come back home and live the lifestyle that he should be living. Well, most of the time we'll be spending on the road. I said that to say this, that a lot of times us men, we don't take control of our health. We allow our wives or somebody else to take control of it for us. And when we reach to the point where we cannot handle it anymore, we just cannot handle it anymore, like in his case. The wife or the mother or some other loved one has to be handling it for you, but it is your body. And I will say this last thing, that if you believe that if you say that you, and let me just say it straight, if you care for the people that you say you love, then you'll care for your body first. Because if you don't, the very persons that you say that you love, your wife, your children, and you're eating anything that you want to eat, knowing fully well that it's affecting your body, it is affecting them much more than you think, because they are the ones who have to pick up the pieces afterwards, the very person that you say you love. And it just doesn't, logically, when you think about it, it doesn't make sense. The Word of God says it prospers more, it wishes for us more than anything that we prosper and be in good health. And if we are Christians, if we are Seventh-day Adventist Christians, and we are all baptized, and we have taken that oath that we are going to do what? Not going to do anything that is harmful to our bodies, then we'll carry out that function, or we'll honor what we said we are going to do when we said, I will. So I just thought I would just pretty much share that, because there are some things this is one of the things that I'm somewhat passionate about. I lost my grandmother. She lost her 2 limbs. That's my father's mother, as a result of diabetes, before she died eventually. My grandfather, his father, died of hypertension and stuff like that. And I know other individuals, both here and otherwise, who have passed on because of diseases that they could have. Well, back in the day, they didn't know much about it, but in today's world, if you have the information, if the church is providing information, God has allowed you to learn about it, then you must do something about it. And if not for yourself, then for your loved ones, for those that say you love. And of course, for honoring God.
Okay. I think we have to finish here, so I'm just giving Natalie 1 minute.
Hold on, Elder. What I want to do is just have you have the final say. I don't want you to miss. So whatever you're thinking about, hold them and add the other one you have to it, because he touched on what I was going to say. The tribe is important. Get to know the family that you are a part of. Not just your biological family, but also your church family. Hear from them what are the things that they learned of while they were going through their struggles. Those testimonies, right? In your own family, track your mother, your father's, everything. What age did they develop this, the next thing? And what things can you do, yeah? We're going to just sing the first verse of Take My Life. We're ending where we began. And then I'll take the last word from our panelists. And I want you to just tie everything up back to stewardship the best you can, all right? That's fine. We're ending off, though. So you can have the final say. Yes.
All right. Go ahead. All right. The moderator say I must go the sign up. You gonna sing?
Take my life and let it be consecrated, Lord, to thee. Take my and all my days, let them flow with ceaseless praise. Let them flow with ceaseless praise.
What happened? I see your face making up. Is this song not right?
You don't know those words.
Oh, it's a different one?
Yeah.
A different song. Live out that life within me.
But go ahead.
All right, take my life and let it be. All right, final. Start from here. All right. Is it to start from here? All right. The final word.
And I will just say something that I forgot earlier that Sister Fletcher alluded to. That we as men, and Elder Colley would back me up, all the men in here would know that we need use of a certain organ. And one of the complications that I did not mention, because I know that we as men are fearful, is impotence, all right? So that's one of the complications. And we don't want that. And our ladies don't want that. So let us, as Elder Colley say, do what we can do to our bodies, protect it, care for it, nurture it, treat it well, so that we don't end up with diseases that could have been prevented, or conditions that could have been prevented, and complications arising from those, such as impotence.
Amen.
My final words are some of what I've already said. I am a health educator, and I believe that each and every person should know about their body. you should learn about your body. You should know about the diseases that are occurring in the world. And you should know how to prevent them. Um, there is so much knowledge that is out there. Well, information. Knowledge is when you actually understand it and use it in your life, then you have knowledge. So God has provided knowledge for his people, information for his people, and for us to get knowledge. So we really need to, we need to take the opportunity to learn. And if we have a particular disease, let us learn about it and learn how we can better handle it, so that we can live quality lives. The truth is, God wants us to live quality lives, irrespective of the situation that we have found ourselves, the sin situation we have found ourselves in, and he has provided the resources for it. And we need to avail ourselves of them so that we can maintain our health. And irrespective of us sitting up here, we all have that work to do. So we might be health workers, but we still have the same fight and challenges that everybody else has. And so we too do the same. So we don't just tell you, but we learn to live the life that we are telling you.
All right. I think I could just, we could have just closed from Brother Colley because he said it right? You have to, if you love those that you have around you, you need to care for yourself for them, because it's really strenuous and stressful when that burden now is laid on you. And I can talk to you from that aspect because I have multiple family members with multiple chronic illness, and it really is burdensome. So when we, the health ministry department, put on initiative to help you to get back on track with healthy lifestyle practices, we want you to all come on board, and we will do so in 2023. And we want to see Savannah SDA coming on board, and not just annually or just for the first quarter making that initiative or making that pledge to make that change, but making it a real lifestyle practice.
Amen. Amen. Okay. So we talk about stewardship today, and one of the T's is the temple of our body. This body of ours was given to us by the Lord, and he gave us that we should take care of it, right? You can't take care of my body for me. The doctor can't take care of my body for me. So it's very important that we take the initiative and care for our body. As the initiative we have coming up in January, I want to live healthy. We should be launching that in January. I want to live healthy. And we all need to make a pledge by the grace of God that we are going to live healthy so that we can honor God. The Bible says, whatever you eat or whatever you drink, do it to honor God. If you want to honor God, honor him with your body in what you do, what you say, what you see, what you hear. Put yourself at the right place so you can hear the right thing and see the right thing and can hear the right thing. Whatever comes from your thoughts, come out as words, and the words come out as action. Okay, so do it all to honor God.
Shall we stand? I think we have just done best for us. The scripture reading that Sister Fletcher had spoke about a while ago, that's 1 Corinthians chapter 10 and verse 31. We had it in our lesson review, I believe, this morning. And we had the other one that began the program, which is 1 Corinthians chapter 6, verses 19 and 20. So we have the information, we have God's word. Let us use it. And you did put on the right song for purpose, and that was Live Out Thy Life Within Me. So God be praised for the Spirit leading at this time. I'm just going to read one quotation from Sister White, and then we head out of here by the grace of God. See. All right.
And while you are listening, looking for your quote, we were preparing to do some blood sugar testing. Sister Kuda is here to do the blood testing. But I don't know if you all need it, but if you need it, okay, somebody say yes, we can do some before we leave.
Okay, so the reading is this, and the topic says, in the master's stead or place. So a steward identifies himself with his master, he or she accepts the responsibilities of a steward, and he must act in his master's stead, doing as his master would do were he presiding. His master's interests become his. The position of a steward is one of dignity because his master trusts him. And that's from Testimonies for the Church, volume, page 246. Right? So, not see, the volume is 9, I believe, here. Yeah, volume 9. So, let us act in as if we are really standing in the place of our master, because that's what he had left us to do. Let us pray. Father in heaven, thank you so much for what you have done in our lives from birth until now. Many things have happened to us, even health-wise. But today, we are still here. Some persons are online. Some of us have experienced losses owing to illness, things like diabetes. We have lost others wherein it is not necessarily chronic illness or due to lifestyle practices. We lost persons just by accidents. But today, wherein we can change the way we live, our habits, we ask that you will help us to do so. For you require us to do what we can to help ourselves, our families, and all those within our communities. Help us to live godly lives. Help us to be wise in what we watch, what we listen to, what we eat, what we drink, where we go, how we clothe ourselves. Take charge, we pray, of us as stewards. May we take care of this body temple that you have loaned us. Lead us now as we leave this place. May your spirit continue to dwell and abide with us and guide us into all truth. In your name we pray. Amen. As we go, we can sing the last stanza of Live Out Thy Life Within Me. Oh, Jesus, King of Kings. The last stanza. It's number 316. And verse 4 says, but restful, calm, and pliant, from bend and bias free, awaiting thy decision when thou hast need of me. But restful, calm, and pliant, from bend and bias free, awaiting thy decision when thou hast need of me. Live out thy life within me, O Jesus, King of Kings. Be thou the glorious answer to all my questionings. Amen.